I planned a letter. We see patients day in, day out, and sometimes we don't pause to reflect on what we're doing. Dear patient, on the nights leading to our first visit, I'm reviewing your story. I look over your test results, your scans, and scour your anatomy. I make a checklist of what we're going to need to do to come up with your final treatment plan. I speak to your other doctors, and we're talking about what's going to happen to you before we've even met. The morning of our visit, you're waiting in an exam room, not knowing what the future holds, what your doctors will say, and what will come next. You've been waiting for this appointment, hopefully for not too long, but I know that it feels like an eternity. Meanwhile, I run over to my clinic, put on my white coat, grab my clipboard, knock on the door, and barge in. We meet, we talk. I start drawing pictures of your insides. We talk about the organs that you should never have to remember that you have. Here's your stomach, your duodenum, your pancreas, your bile duct. Here are the blood vessels to and from your intestine. Here's your tumor. Even when I do my very best to keep it simple, it's hard not to use big, fancy, frightening medical words. We're trying to do the impossible. I try to condense 20 years of education into 20 minutes of conversation. Sometimes I have to tell you that we can't get to surgery. Sometimes I get to tell you that we can. Many times we won't know the final answer for several more months. While I'm talking, I see that your leg is shaking. I see that you grab your loved one's hand. Sometimes you cry, sometimes you have a long list of questions that we go through. Many times you're silent. Almost always you're overwhelmed and you're scared. You want it to all be over and to go back to the past and never have to look forward again. But somehow, somewhere during our meeting, during our time together, you rally. You summon the courage to move out of sadness and shock, to accept the uncertainty and certainty. You accept more tests and treatment. You figure out a way to find it in yourself to face the future. You are standing at a crosswalk, but instead of being paralyzed with fear that you might get hit, you look right, you look left, and you look forward. Sometimes you say to me that you're a fighter and you will never give up and you're going to be cured. And I tell you that I applaud you. And I will always respect your choice of these terms, especially if they help you to face each day. But I also tell you that I don't use them. Because to me, there is no giving up and there are no losers in this struggle. If you face tomorrow with a clean scan, then yes, you're a survivor. And if you choose to go into the operating room or to have another round of chemotherapy for a recurrence, you're still a survivor. And if one day you choose to go for a hike instead of going back to the hospital, you're still a survivor, and I support you. The cure is not something magical for us to attain in the distant future. The cure is today. And one day turns into 1 month, into a year, into a decade, and into a lifetime. Dear patient, I went into surgery because as a third-year medical student, I thought that delving into the human body and studying the complexity of human anatomy was the closest I could get to the face of God. But I know now that the true face of the universal spirit is not in the operating room. It's at the bedside. It's in holding your hand and in seeing your face that I get to honor the miracle of the human spirit and of human life. Signed very respectfully and humbly, with gratitude, your doctor.